So Brazilian waxing is not right for you. So stop Brazilian waxing. Trim those pubic hairs to a reasonable size that you can keep clean. So what's up guys? So welcome back to my YouTube channel. I hope you guys are doing good. So welcome back to yet another episode of Full Auto Soil Education. So in today's video, I want us to talk about the don'ts. The don'ts. Things that you as a woman need to moderate or stop doing. Okay? Because these things or these practices will give you infections at some point in time. Okay? So the practice number one, or one thing that you really need to stop doing, is what we call douching. So many of you may not be conversant with the term douching, but douching simply refers to a situation or a condition whereby you've decided, you as a woman, you want to do total cleanup, you want to clean even the deepest end of your vagina, of which we all know this is not healthy for you. So douching is not allowed. You should stop douching if you have been douching. So different women douch for different reasons, or you feel the urge or need to clean the deepest end of your vagina for different reasons. Some do that because they're experiencing or they're getting some vaginal odor or smell. Okay, some just feel that they have to stay healthy, so they think cleaning to the deepest end of their vaginas will help them stay or remain healthy. So douching is not allowed. Douching is not safe. So if you've been douching, you need to stop that. So different, or some women do douch. They just get that piece of bathing towel, they apply some soap, and then they get to the inside, to the farthest end of their vagina, trying to clean up, and so that they can stay clean and healthy and not get the vaginal smells. But one thing that you need to know is when you have a vaginal smell, the one tells you one thing. By default, you have an infection, and by cleaning to the deepest end will not help you. I'm sure for those who have had some of these vaginal infections, you found yourself in a situation whereby you had to take so many showers. Or in a day, you would even take like 3 or 4 showers because you have that smell and you find it so uncomfortable to have that smell. So if you have any vaginal smell, that means that you have a vaginal infection that needs to be treated. So cleaning up will not help anything. So you clean it after a few minutes, after a few hours, then you realize you still got the smell. So douching will not help anything. In fact, douching will just mess up with your vaginal pH. So we all know that you need a healthy or a standard pH value of your vagina so that you can stay healthy and avoid getting infections. So the normal vaginal pH should always be between 3.5 and 4.5. Okay. So the moment you decide to douch, use soap to clean the deepest end of your vagina, then definitely you're messing up with the pH. Then you're getting exposed, or you're just predisposing yourself to getting more vaginal infections, and especially recurrent yeast infections. So if it's about douching, you really need to stop douching. The practice is not safe for you. So stop that practice. Okay, we will not say moderate, we will say stop douching. Okay. The practice number 2 is about steaming. Steaming. So for those who don't know what steaming is just whereby you just get yourself some steaming herbs, then you prepare some hot water, then you dip these steaming herbs inside that hot water. As a result, of course, we know when you have some hot water inside maybe a basin or anywhere, you know what happens. There is always that steam that is coming out. So the moment you prepare the steaming herbs with hot water, of course you expect some steam to come out. Okay, so most women do steam. So how do these women do the steaming, or how is steaming done? So after preparation of the steaming herbs, someone just decides to sit over that steam that is being produced from that basin with hot water. So most women do steam, again, for the same reason, because they have a vaginal smell. Remember, steaming has no medical background or medical significance, whereby research has shown that steaming does not help in treating vaginal smells. But some will say, I tried it, it helped me, it worked out, but it is not healthy for you, because you're actually risking messing up with your pH, which we said is very important for you if you have to prevent yourself from getting recurrent infections. So steaming is all right. You also risk burns and scars. We all know that your vagina is lined up with very fine or thin membranes. Thin membranes. So that is a mucous membrane. So you risk burns. You risk scars from that hot steam. And in the previous episode, there is a video that I was talking about practices, and I said that you should try as much as you can to avoid hot burns. So you should not be cleaning up your vagina with anything that is so hot. You should always use anything that is warm. If it is water, it should be warm, not hot, or cold. So you have to stop steaming. Not moderating, stop the steaming practice. Steaming is not healthy for you. Okay? So if you have a vaginal smell, again, the right thing to do is to get treated for that vaginal infection that is bringing about that vaginal odor or smell. Okay? So the practice number 3 that I want us to talk about is about waxing. Most of you are big fans of waxing. Waxing is not right. So the same reason why you don't bother yourself with maybe clearing up the hairs found inside your nostrils is the same reason that you should not be waxing. So the hairs, any hairs that grow anywhere in your body, they go in those places where what we call a rationale. They have the importance there. So you should not be steaming. If you have to maybe stay healthy and clean, then you don't have to wax. The only thing that is recommended for you to do is just doing some, maybe you just trim the hairs and keep them clean, but don't completely shave. Don't clean shave and don't wax. So Brazilian waxing is not right for you. So stop Brazilian waxing. Trim those pubic hairs to a reasonable size that you can keep clean. Because I know most of you will complain about when I'm on my periods, you know, there is a way those hairs get stuck on my pad, and then removing when I'm trying to get off the pad, it becomes so painful because I'll be pulling the hairs, you know. It is so uncomfortable, you know. Some will also say when I'm on my periods, the blood tends to get stuck on the hairs, and then you get a bad smell. Okay, of course that is expected to happen if you don't maintain or observe high standards of personal hygiene. So you're supposed to trim the hairs, keep them short, and then make sure that you clean them up. Take a shower, take regular showers. As a lady, you should be taking at least 3 showers in a day, okay? And especially if you're on your period, okay? So that is practice number 3, stop waxing, okay? So practice number 4 that you really need to check on is about eating junks. Eating junks, eating the fries every now and then, eating pizzas, eating just too much of calories. It is not healthy for you. Why? Because eating too much junks will keep on giving you recurrent yeast infections. Just have a look at those women who have, or women who just solely depend on junks. They always feed on junks. They always eat junks. They always have to treat recurrent yeast infections, okay? So stop, or I will not tell you to stop eating junks. I will tell you to moderate. Moderate the intake of junks and calories. Moderate intake of junk food, because you keep on treating recurrent yeast infections, okay? I hope that is clear. That is also another reason why you realize that women who have or women who are diabetic keep on getting recurrent infections, okay? Because yeast love sugar. Yeast love sugar. So if you're diabetic, most of the time you'll be battling or fighting recurrent yeast infections, okay? So that is practice number 4, moderate intake of junks. moderate intake of drugs. The other thing that you really need to check on is about self-medication. Self-medication is not good. It is not good. So there are at times, or there are few occasions where women find it so important or so conveniencing to self-medicate, especially when you're on your periods. Mostly when you are on your periods, and maybe sometimes when you have some of these infections, maybe yeast infection, bacterial vaginosis, or you're getting some signs of vaginal infections, maybe itchiness, burning sensation, painful urination. So you just come up with an idea that I'm battling yeast infection, or I have urinary tract infection, so I just need to go to the chemist or the pharmacy and purchase over-the-counter medication and treat myself. That is not right. Why? Because if you do what we call a misdiagnosis, for example, if you have yeast infection, then you do a misdiagnosis and you think you have urinary tract infection, then you go for antifungal medication. Okay, so if you have yeast infection, you should treat yeast infection using antifungal medication. But if you think you have urinary tract infection because you just diagnosed yourself and in the real sense you have yeast, so over-the-counter medication that you go for antibiotics. So you'll be treating the wrong thing using antibiotics. Okay, so that is a misdiagnosis with time, because you realize this thing is not responding to medication, so you keep on purchasing these drugs. So end of the day, you develop what you call antibacterial or antibiotic drug resistance. Okay, so drug resistance just refers to whereby, because your body is so used to certain type of medication, and especially antibiotics, anytime you need any of these antibiotics, they will not help you, will not respond to these antibiotics, because your body is so used to these antibiotics. Okay, so stop self-medication. The other time or situation where women do self-medicate, I just mentioned it, is when women are on their periods. Okay, so you just find yourself not in a position to withstand the menstrual cramps. Menstrual cramps are a normal thing in any woman who is menstruating. Okay, why? Because of the action of two hormones, prostaglandin and oxytocin. So they help in slight dilatation of the cervix and mild contraction of the uterus, so that the shed endometrium in the unfertilized egg can be expelled out of the uterus, because you're not getting pregnant. Okay, so the action of the two hormones gives you menstrual cramps, but sometimes these cramps can get so severe. So they can be severe if you have fibroids, if you have polyps, if you have endometritis, if you have PID, if you have ovarian cysts. Okay, and if you have fibroids. Okay, polyps and fibroids, and also if you're using hormonal, not hormonal, but if you're using an IUCD or a coil, so the pain is aggravated by these things. But if you don't have these things, so when you have those conditions, you realize that the pain is extreme. It is so painful for you to handle. Okay, but it is not advisable for you to keep on taking medication. Okay, whereas you don't know why you have these serious period pains. Okay, so if you don't have these extreme pains or cramps, don't self-medicate. And if you have extreme pains, don't also self-medicate. Make sure you seek some medical attention, get checked, get reviewed, so that the problem can be identified and you can be treated, so that you stop getting those the deep excruciating period pains. Okay, so for those who just get the normal cramps, stop using these NSAIDs so regularly, including the ibuprofen and diclofenac. Why? The more you use this NSAID medication, they predisposes you to getting what we call peptic ulcer disease, or what you call ulcers. So you have to stop self-medication. Okay, I hope to that point we're together. So that is practice number 5, or the thing number 5, or the don't number 5, or among the things that you should stop, moderate, or change. Okay, so that you don't keep on getting infections every now and then or in future. Okay, So there are so many of these practices, there are so many don'ts that you have to check on. Okay? The other practice that you really need to check on, or practice number 6, is about putting on thongs or G-strings. Okay? So putting on G-strings or thongs will keep on giving you recurrent UTIs. Why? Because that G-string or thong, you know very well it is never stable. So it keeps on sweeping from the back to front. Back to front as you walk. You know, you cannot stop that. As long as you're busy walking or you're working, then definitely this thong will keep on sweeping from back to front, carrying perianal contents or E. coli from the perianal region towards your vagina, and this one will give you an infection to keep on giving you recurrent UTIs. So maybe you have been putting on these G-strings or the thongs and you didn't know they keep on bringing you these infections. Of course they do. So stop putting on G-strings. Stop putting on G-strings. But there are those, there is this one group of women who will tell you that, you know, I've been putting on this thong for the longest time. Like for 20 years, I've been putting on these G-strings and I've never had an infection. Remember, bodies are different and you're still not done. As long as you're alive and as long as you're a woman and you still keep on putting on these G-strings, one day you'll have them, these infections, okay? So to prevent or to protect yourself from getting these infections, stop putting on G-strings, okay? Stop on putting G-strings, okay? So just put on the normal cotton-made panties that will help in free circulation and aeration of air so that you don't get these infections. So I hope you check on those practice, okay? So because there are so many, I think I will continue with the rest in the next episode. I'll do part 2 of the same. So stay tuned. I hope you have learned 1 or 2 things. So don't forget to leave a comment on the comment section, like the video, share the video with your friends, and most importantly, make sure that you subscribe and turn on the post notification bell so that you get notified every time I upload new content or a video. So see you in the next episode.